to our virtual financial literacy workshop. My name is Alta, and joining me on our community relations team is Roxanne and Charlotte. We also have our community helpers present today to help us host this exciting webinar from Adult Protective Services. Ms. Lakisa Rockwell, who is the evidence-driven investigations subject matter expert, and Ms. Katrina Wall, who is the faith-based and community engagement specialist. Thank you, ladies, so much for joining us and for helping us facilitate today's workshop on elder exploitation. We also would like to thank our compliance officer, Brenda Miranda, for joining us for later today's Q&A session. So before we begin, I'd like to take a moment to tell you a little bit about Neighborhood Credit Union. We were originally known as the Dallas Postal Credit Union, and Neighborhood Credit Union opened its doors in April of 1930, and we just celebrated 91 years. In 2001, the credit union officially changed its name to Neighborhood Credit Union. We now serve more than 56,000 members with assets over $1 billion. And Neighborhood Credit Union's ongoing effort to offer members convenient services in their communities and mobile access wherever they go has made us a top-rated credit union in Dallas-Fort Worth. So I am going to hand our workshop over to Ms. Lakisa so she can tell us all about elder exploitation and abuse and how we can be a great support for our community helpers at Adult Protective Services. So Ms. Lakisa, I am going to mute my mic and let you take it away.
Okay. Good morning to everyone. I appreciate the opportunity to be able to share the information about Adult Protective Services with the community. I know that a lot of people are not familiar with our agency, and I hope at the end of this presentation, you keep us in mind and reach out to us if you or anyone you know could use our assistance. Next slide. So let me start out by giving you an overview of Adult Protective Services. The mission of Adult Protective Services is to protect older adults and persons with disabilities from abuse, neglect, and exploitation by investigating and providing or arranging services that are necessary to alleviate or prevent further maltreatment. Next slide. APS operates under the authority of Chapter 48 of the Texas Human Resource Code. We are authorized to investigate reports of abuse, neglect, and exploitation. Our clients include anyone 65 or older and adults with any disability that substantially impairs their ability to live independently and provide self-protection. Our clients also include persons receiving services in state-supported living centers, state hospitals, community centers, state centers, or home and community-based services. Next slide. APS is a statewide agency, and the Dallas-Fort Worth district covers 19 counties. Some of the counties include, of course, Dallas and Tarrant County, but we also cover Palo, Kaufman, Grayson, and Navarro. As you can see, our district covers a vast part of the state. Next slide. I would like to provide you with some context regarding the number and type of cases that we receive throughout the state and throughout the district. In the fiscal year 2020 statewide, we received 115,441 intakes. We completed 86,614 investigations, and of those investigations, we're able to confirm 52,506. Next slide. In the fiscal year of 2020, the DFW district received 24,052 intakes, completed 16,501 investigations, and were able to confirm 10,108 cases. Next slide. Now, the allegations that we investigated, statewide exploitation allegations were 15,832. Physical neglect, as you can see, was 82,325, with medical neglect following as the next highest with 20,014. Next slide. Within the DFW district, those 19 counties, We received 3,542 exploitation cases. Physical neglect was 15,855, and on trend with the state, the next highest was medical neglect with 4,180. Next slide. Now, you may be wondering how cases are reported to Adult Protective Services. Individuals contact Statewide Intake, which is our 24-hour call center, and reports are made by phone or by email. Once the case is received, it's routed to the appropriate area in the state. All investigations begin within 24 hours. Contact is made either in person or by phone, and that contact is needed to determine if there are any immediate interventions that are required. Some immediate interventions can include medical treatment or obtaining medication or food, relocation to a safe location, or even assistance from law enforcement. APS is never closed. We operate 24 hours a day, 7 days a week to meet the mission of our agency. Next slide. When the cases are received by Statewide Intake, they are assigned a priority to determine when a face-to-face visit will be made. Priority is assigned based on information obtained during the call or from the email. A P1 means a client is in a state of serious harm or danger of death, and the face-to-face will be conducted within 24 hours. A priority 2 means the client is at risk of serious harm, and the face-to-face will take place in 3 days. Priority 3 will be all other cases of abuse or neglect, and that face-to-face will take place in 7 days. Our priority 4 would be our exploitation cases where there is no immediate danger of our clients going without any of their needs being met. That face-to-face will take place in 14 calendar days. Now, based on additional information obtained by APS, those visits can be made sooner. Next slide. Within APS, I work with in-home investigations. We conduct investigations in the private residences and unlicensed boarding homes and some adult foster care homes. Next slide. When APS begins our investigation, we look at several factors in order to obtain the total picture of what is going on with our client. Some of the areas that we look at are living conditions, if there are any concerns with cleanliness, structure, or safety. Physical and medical. Does the client have their needed medications? Do they have a primary care doctor? Do they have care services in the home, or do they need those services? Social interaction and support. Who does the client depend on or call on for assistance or for companionship? Or is the client isolated? Financial status, is there steady and reliable income coming into the home to meet the needs of the client, or do they have unmet financial needs? And mental status, are there any concerns with memory loss, any Alzheimer's or dementia diagnosis, or any mental health diagnosis? Next slide. Once we have obtained the big picture, we may provide some services. And some of our services include emergency assistance for rent and utilities, assistance with medications, transportation, and food, emergency shelter, such as a boarding home or a hotel, and referral or collaboration with other community services, including guardianship and law enforcement. Next slide. Now, let's take a closer look at what we investigate. Abuse is any knowing, reckless, or intentional act or failure to act that cause physical injury, emotional harm, or death, including such acts as inappropriate or excessive force, unreasonable confinement, intimidation, or corporal punishment. These types of abuse would be sexual, physical, or emotional. Next slide. Neglect is going to be the failure to provide for oneself the goods or services, including medical services, which are necessary to avoid physical or emotional harm or pain, or the failure of a caretaker to provide such goods and services. These types of neglect would be physical and also medical. Next slide. Exploitation is the illegal or improper act or process of a caretaker, family member, or other individual who has an ongoing relationship with a person aged 65 or older or an adult with disability that involves using or attempting to use the resources, including the person's social security number or other identifying information. Next slide. And using these resources for monetary or personal benefit, profit, or gain, and without the informed consent of the person. Next slide. When we're looking further at the definition of exploitation, it focuses on informed consent, meaning that a victim knowingly agreed to the use of funds for a specific purpose. There cannot be any informed consent if it was not voluntary, induced by deception or coercion, or given by a victim who the perpetrator knew or should have known was unable to make informed and rational decisions because of diminished capacity or a mental disease. Next slide. Financial exploitation of elderly and disabled is an increasing problem. Exploitation is the most underreported, with 74% of incidents not being reported. And another study shows that 1 out of every 44 cases is reported. Elders are exploited for up to $36 billion each year. And when a senior loses their life savings, it's unlikely that they can recover because they don't have a number of years to recoup all of their losses. And due to the financial hardship, embarrassment, and loss of trust, it can lead to depression, medical complications, and premature death. Another study shows that the largest percentage of reason for not reporting these cases is embarrassment. Next slide. The elderly are often targeted because they are typically trusting, their openness to marketing appeals, a lack of knowledge of the types of frauds and scams because new ones are popping up every day. They're unaware of the value of assets, and that could be jewelry, they could have antiques, anything that they have in their home. They may not know the value of it, but someone else may not be able to recognize what has happened to them, and they're likely to protect the perpetrator. Next slide. So why are they more likely to protect the perpetrator? It's because 90% of perpetrators are the people victims know well. And these perpetrators include family members, friends, and neighbors. These people usually have the most access to the client and usually the most trust. We have home care aides who have normally unlimited access to their homes as well as their personal belongings. And we have contractors and financial advisors who are knowledgeable in their field or appear to be. They seem helpful and they establish a trust relationship with the client, and then they take advantage. Next slide. So what are some things we can identify that might be red flags for exploitation? We can see sudden changes in the bank account or banking practices, such as online banking, where the client begins to use online banking where they've never used it before. And we can see things such as Zelle, Venmo, Cash App, Apple Pay, things that normally elderly clients would not be aware of or use. New names are added to their existing bank accounts, where we may see numerous signature cards when we obtain records from the bank where they are adding people and taking people off of their account often. Paying bills for someone else. The client doesn't own a car, but we start to see payments that are going for a car payment. Transactions at an ATM where they may begin or increase. The locations may not even be close to the client's home. They can even be out of town or even out of state. Next slide. Unusual checks written to cash, changes made to their will, deed, or property title when persons seem incapable of making those changes, and an unfamiliar person with the customer when they come in and they're withdrawing large sums of money. And you may also see this person coaching the client as to what they came into the bank to accomplish. Next slide. We also see abuse of funds by power of attorneys. These are people that the client has given authority to handle their finances. So this is likely someone that they trust, and that person is taking advantage of them. Unexplained sudden transfer of assets. So we may see large amounts of money being transferred online into another account. Unpaid bills despite the client has adequate money in order to pay their bills each month. So that would indicate that their funds are going somewhere else and it's not going to meet their needs. Next slide. And now let's look at some of the common financial scams. The first one is going to be the sweetheart scam, where there's a promise of a love relationship and tend to be much younger than the victim. Also, a lot of these relationships, they never meet. They are typically online, and they may be even out of the country. Charity scams, that would be someone soliciting money for a charity that they may or may not be associated with, or the charity simply doesn't exist. And health, funeral, life insurance scams, where they attempt to sell duplicate and existing coverage, convincing the elder that they do not have sufficient coverage for, say, burial or life insurance for their family to be able to continue to meet needs. Next slide. Confidence scams are where such as the lottery scam, where you have a winning, but you have to make a good faith payment or pay some type of fee in order to receive that winning. The grandparent scam, where the grandparents receive a call that their grandchild is in jail and is in need of bail money. The call is usually late at night so that the grandparent is confused. The person is frantic. Something has to be done immediately. And it's not only the grandchild, it can be other family members. And with the pandemic, one way that they are using that is to say that the grandchild has also tested positive for the coronavirus and that they are not going to get adequate treatment while in jail. So you need to bail them out so they can be treated at a hospital. Scammers are obtaining a lot of information for this type of scam by doing a deep dive into social media, where they obtain names and other information to make the call seem more legitimate. And from 2015 to March of 2020, the Federal Trade Commission reported 91,585 victims of imposter scams. Next slide. With the coronavirus, there has been an increase in isolation and fear, and scammers are using this to their advantage. So some of the scams we are seeing would be Medicare fraud, where there's uninitiated contact from someone posing as a representative from Medicare, requesting the Medicaid number for testing for vaccines. They also would take this information and make other fraudulent medical claims. Charities are popping up that are said to be related to assisting victims of COVID or providing supplies or other things in reference to the virus, but that charity probably does not exist. Stimulus checks, as we know, people were receiving stimulus checks during this time. If the scammer has already obtained the necessary information, they are stealing the checks. But there's also an attempt to get you to pay a fee in order to get the check. They send emails asking you to fill out applications in order to get the check, and then from that application, they obtain the information concerning the client. The vaccine and contact tracers, before the vaccines became readily available, there were fees being paid to move up on the list for the vaccine. They were also providing vaccines in the home, the alleged vaccines or other treatments for the virus. Contact tracers, people were being contacted that they had been exposed to someone who tested positive, and that in order to get this information or to follow up, you click a link. And once they click this link in their text message or their email, it would download a virus where it would enable them to obtain their information. Investment opportunities would be investing in companies or stock that did not exist, that was working on cures or testing, and also any type of equipment, personal protection equipment, and things like that. Surveys would be receiving an email or a text from Pfizer or from Moderna asking you to complete the survey, and you would receive a reward. But in order to receive the reward, you'd have to pay a fee. And that would involve you providing them with a prepaid debit card, a credit card, or your account information. Next slide. So what are some of the ways that you can protect yourself from some of these scams? Don't share your personal information, such as your Social Security, Medicare, or credit card number. and especially if it's coming unsolicited from a call, text, or email. Be very skeptical about fundraising calls or emails, especially if they pressure you to act fast. They want you to get prepaid debit cards or credit or gift cards. And definitely ignore phone calls or emails from strangers, especially if they're urging you to invest in something, anything that's asking you for your bank account, credit card, any identifying information. Next slide. Have a trusted person that you can contact, that when you receive these type of mailings or calls or texts, that you can call that person and run it by them to find out if it's legitimate. Someone that you trust that can give you advice in these situations. And never verify your personal information over the phone, especially if it's just an unsolicited call. Also, get a copy of your credit report each year so that you can make sure no one is attempting to use your credit or making any inquiries into your credit. And do not sign any documents that you don't understand or agree to any services that you do not want or that you did not order. And the last one, which I think is very important, shred all your documents that have any of your identifying information. Next slide. If you need to make a report to Adult Protective Services, you can make the report through our hotline, and the hotline number is 1-800-252-5400, or you can make an online report using our secure website. Next slide. I would just like everyone to remember that protecting vulnerable adults is everyone's business. And I hope that you are now more aware of who we are as Adult Protective Services, what we do, and how we are able to help. And the contact information for myself and the other exploitation expert is available on the screen. And thank you for your time.
Wow. Thank you so much, Lakeisha. That's some great information. Okay, so we are going to go ahead and stop recording now.